you became a nurse?
I like helping people. I like working with people, for people. I liked Phyllis Nightingale. I liked her whole concept. When I went to scrub school, that was one of the first things that they talked about was her. So it made me want to go on to be an RN.
Good. Thank you.
I wanted to be a nurse since I was 14 years old. My cousin was born with spinal bifida, and I had to help out with capping him and things like that. So I wanted to be a part of the nursing staff to help better the community and, just wanted to make a difference.
Because I had always thought I would be in healthcare because my mom was a nurse. But my mom told me when I was little that I was too soft-hearted to be a nurse. So when the time came for me to pick a career, I picked surgical tech because all my patients would be asleep. Well, after 20 years of that, I decided that I had seen enough and toughened up enough after working at a trauma center that I could handle the face-to-face interactions. So I went back to school. Plus, I needed more money. But that was really a secondary reason, and that was why.
Ever since I was a little girl, I always knew that I wanted to be a nurse. I always loved people, and I always loved caring for people. And when I got to high school, they had a health occupations program, and I got into that. And I found my love for geriatrics when we went to the nursing home for our clinicals. So the Lord continued to guide me in that way. So I went to nursing school and started out in the nursing home, and I loved it very much. But He gave me the opportunity to increase my knowledge and go get my RN degree. And then I stepped out on faith and came to the hospital where I've been here for 7 years, and it's my heart. I love it here. It's a great place to work, and can you pause it?
Well, I've always enjoyed helping people, and I've done a lot of different jobs in my life, and I finally decided I would do something that meant something a little more. So that's why I went into nursing. And do I enjoy it? Yeah, I love it. I love taking care of people. I love the patients. You learn something from each and every one, they're so really neat. And I don't know, I guess probably the most memorable thing that sticks out in my mind is really silly, but it's a couple of patients I had that just had this great sense of humor. They were elderly, and not a whole lot of people came to visit them, but they were wonderful people, and I felt, really sad that people didn't come visit them because they were so wonderful. And one little lady, she was telling another lady a bunch of stories and just joking with her and stuff, and I walked up to her and I said, and her name was Ernestine, I said, "Ernestine," I said, "what are you doing?" She said, "Nothing." I said, "Oh, you're nuts." She said, "No, I was nuts, but they cracked me, now I'm just plain crazy." And stuff like that. And it just tickles you to death,
Ever since I was just a little girl, and unfortunately I never had the opportunity until I was in my 40s, when all my friends and my husband encouraged me to go back to school. and I did, and it's been the most rewarding thing that I have ever done. Even though it makes me a late bloomer, I at least did it.
Okay, so Lisa, how long you been a nurse and what made you become a nurse?
It's been a long time. Let's see, 30 years. Wanted to go to college right out of high school and thought, I want to be a dental hygienist. Well, somehow that turned into a nurse. Mom helped me write my acceptance into nursing school, Millwood Fillmore Nursing School, Buffalo, New York, way back when. Who would have thought? So, I sat in that chair, I listened to the orientation, and they accepted me. So here I am, taking care of all these people. Wait.
If I was going to be away from my children, I wanted the job that I was doing to be meaningful to someone. So I wanted to enrich the lives of others.
I wanted to become a nurse because helping people made me feel wonderful. And whenever I was able to help someone go from feeling absolutely rotten to feeling better, it's just very exhilarating. I'm an epinephrine junkie, recovered, I suppose. I love excitement of the ER, having somebody that is close to the brink of death and bringing them back. There's no feeling quite like that.
Thank you, Millie.
You're welcome.
Hi, Cheryl. And why did you become a nurse?
Well, I was in a paramedic. That's the only thing I have really ever wanted to do when I was even in high school. That was, I put in my printed senior page that my ambition was to become an RN, and that's what.
And we've spent lots of ambulance time together,
yes,
haven't we?
Yes, we have.
All right.
Lots of trips to Erlanger.
With all good outcomes. Okay, thank you, Cheryl.
Oh my God, are you serious? When I was a little girl, I wanted to get a shot. So I became a nurse so I could stick people. Nothing better than that, huh? Yeah. And I finally ended up in surgery where it's really invasive, so it's good.
I became a nurse because my mom was very sick, and I never understood any of her disease processes. I never understood why she was having seizures. I never understood her asthma. So I became a nurse so I could take care of my mom. And also, so I could get a job anywhere I wanted to. Because I moved around a little bit when I was younger. I didn't know what I wanted to do. So I became a nurse to help my mom and to have a job I could always count on.
Okay, Kelly, why did you become a nurse?
I became a nurse because I like to help people and make a difference in people's lives.
Janet?
Okay, my interest in nursing began when I was actually caring for a sick husband who was on dialysis, and I was doing his treatments 3 days a week. And when the nurses at the dialysis clinic had to train me to do his dialysis, they really encouraged me to become a nurse because they said I was really good at catching on and, you know, doing patient care, and they encouraged me, and that's when my interest in nursing began, and I went on and become a nurse.
I always wanted to be a nurse since I was 8 years old. I used to play with my dolls and the wagon train, and I never wanted to be anything else. And I've been a nurse now 41 years, and I can't think of anything that I would be able to do or would want to do anything else.
Hey, Angie, what are you doing here on days?
I have no idea.
Okay. All right, Angie, why did you decide to become a nurse?
Oh, I guess just to help people.
That's a good thing. I think it's because we all have a gift for it.
Yes.
Okay, good. Thank you, Angie.
You're welcome.
Well, when I was 17, I was an orderly, and I enjoyed what I was doing, so I went back to school. And at 19, I graduated as an LPN, worked for 20 years doing that. And in 1989, went to college, got my RN. Have enjoyed what I've been doing ever since. I think I've made a difference to a lot of people, and plan on doing it until I retire.
I became a nurse because of my dad. Severe heart attack at the age of 40 due to damage from rheumatic fever. And of course, being in a very rural area, nobody was very aware of anything. Nobody knew CPR or, you know, anything about medications, medicines. And I watched him decline. When he went to the cardiologist, they told him he had two choices: have open heart surgery or die in 5 years. And the consequences of open heart surgery was death, coma, maybe coming off the table, semi-normal. And he said no. So he gave up that choice and said, how long do I have? And they said 5 years. And he died exactly 5 years after.